I'm Emily Mashak, and you are listening to Tuned Into NoCo, Town Square Media show that lets you know what matters in NoCo. I'm talking today with Monte Labash, an acupuncturist with Del Sol Community Wellness, about the physical and mental health benefits of acupuncture. So thank you for joining me today, Monte.
Yeah, thank you for having me, Emily.
Of course. Now, before we get started, I'm going to go really basic. I think most people know that with acupuncture, it's where you get needles put on you. But can you explain in depth what the practice of acupuncture actually is?
So, acupuncture is just one facet of Chinese medicine, and all facets of Chinese medicine are based on traditional Chinese medicine theory. And the theory at basic is energy, or as we call qi. And you have so many different types of qi that deals with pain, qi that deals with your immune system, qi that deals with your organs. So, at a very basic level, everybody knows that acupuncture is great for pain management. So, what's happening with physical pain is that chi that is flowing throughout your body gets stuck for whatever reason. That could be due to major injury, or it could just be due to overuse of the muscle. And so when it gets stuck, what we do is we use acupuncture needles, maybe locally or along that channel, to free up that chi to get it free flowing.
Okay, I gotcha. Now, for listeners who are unfamiliar with Chinese medicine or are more used to Western medicine, how does acupuncture work with Western medicine? Can it be intertwined or is it separate? And I guess how does the Western medicine world view acupuncture?
Of course, it can be used together. So, like I described the pain aspect on a Chinese medicine level, I can also describe it on a more physiological level. So, whenever you have pain with the insertion of the needle, that's telling the muscle to relax. It's also reducing local inflammation. And then it's also releasing natural opioids to the area, such as endorphins, in order for you to have that feel good feeling and pain relief. And so it can definitely also be used intertwined with more of a Western medicine view as well. And that can be, again, I go back because everybody knows pain in acupuncture. It can be used in addition to post surgery. So if you're getting, for example, like a hip replacement, you can have acupuncture done as a post operative care to kind of help that area repair. Even beyond pain management, acupuncture is great for an alternative or complementary to cancer treatment. So, such as chemotherapy, we can help with the side effects of a chemotherapy, like the nausea or the lack of appetite. And even now, we're seeing more patients come in who are going through IVF. And we're using acupuncture to bring that blood flow, to bring that nutrition, bring that energy to the uterus in order for that IVF implantation to take.
Right, right. Do you recommend consulting with a primary care physician before you start acupuncture?
Yes and no. If it's something very basic, such as muscle fatigue, I don't see the need to consult with a doctor. But if it's something very serious, such as cancer or other chronic diseases, I would say, yeah, you could definitely consult with your medical doctor or your primary care. And most of the time, they're going to say, if you're comfortable with it, go for it.
Gotcha. Now, tell me a little bit about you. How did you get into the field of acupuncture?
Right. So I I didn't really seek it out. It kind of sought me out, if that makes any sense. I kind of just fell into it. I grew up on the East Coast where there really wasn't a lot of acupuncturists or Chinese medicine around. Um, I knew that I wanted to get into healthcare, and medical school was, the most viable option that I thought I had. And so when I was at the crossroads of like when I really needed to make that decision, I went back and kind of looked at my own morals whenever it comes to medicine. And I'm a proponent of lifestyle and preventative medicine. And more of the alternatives are definitely stress that. And so I was a long-term patient of chiropractic, and so that was something that I was going to pursue. But then I found acupuncture, Chinese medicine, and I found, wow, okay, it treats more than just pain management. It's also internal medicine as well. And so I ended up at my school, Southern California University of Health Sciences outside of LA, where they offer both chiropractic and a doctoral program in acupuncture and Chinese medicine. And so I was initially going to pursue both, but I really found acupuncture, Chinese medicine a little more interesting. And so I decided to focus on that. And as I became a student clinician and now in my early years as being a licensed acupuncturist, I'm really seeing the changes that acupuncture can have on people's health.
And now you are with Del Sol Community Wellness. What is your practice like there?
So Del Sol Community Wellness, it is more of kind of like an integrative practice of things alternative. So of course we have acupuncture. We're now introducing some Chinese herbs to the practice. We also have all forms of massage therapy, including craniosacral. And then we also offer small yoga and fitness classes.
Very nice. Now, I have actually done acupuncture before, and one of the things I used it for was anxiety. Can you touch on how acupuncture can be beneficial for mental health?
Yeah, of course. I mean, right now is everybody's very anxious, everybody's very stressed out, and that is something that I'm starting to definitely advertise for acupuncture and anxiety stress. So, what is going on is that we are getting these anxiety symptoms, such as like a racing mind, or it could be shortness of breath, chest pain. Some people will get have sweaty hands. I mean, everybody's symptoms are all different. And before I was talking about different qis. So, when we talk anxiety, we're talking liver qi and we're talking heart qi. And so those two organs' energies are affected with anxiety. And so what we're trying to do is, like I was saying, liver, we're overactive liver. We're getting that racing mind. We're getting uneasy. We're getting, shortness of breath. We're breathing heavy. And then your heart plays in whenever you get those symptoms at night, or it's causing you not to sleep, or you're literally having pain around your heart, or that chest pain, and you feel like you're having a heart attack. And that's because the heart is deficient. And so the goal is kind of to sedate that liver and to tonify that heart. And so I also describe it more on a physiological aspect. We have two different parts of the autonomic nervous system. We have our sympathetic, which is the fight or flight mode, which is liver, and parasympathetic, which is more of your rest and relax, which is going to be more so heart. So, like I was saying, we're going to sedate that liver or sedate that sympathetic nervous system, and we're going to tonify that heart, or we're going to tonify that parasympathetic nervous system.
I see. And you mentioned earlier about how acupuncture can help with physical aspects such as nausea or things like that. Can you just go into more detail about how acupuncture can help with physical health, especially as it relates to our environment right now?
Oh, yeah. So, as far as like internal medicine goes, we can definitely help when it comes to things like your immune system, which everybody is trying to prevent getting sick, and also it's summertime, so people have allergies as well. So, like I was saying, we have different types of qi, and one of them is like more of our defensive qi, or the Chinese term would be wei. And what we do with that is we have specific points that definitely deal with that, that are classically proven to work or have those properties that help boost the immune system. But we're also looking at strengthening the lung. A lot of communicable diseases do affect the respiratory system. So we definitely will tonify or strengthen the lung channel or lung qi. And that's also in regards to allergies as well. As far as, the seasonal allergies everybody's coming in for as well, and they're getting the symptoms of like post-nasal drip or the watery eyes, or they're getting kind of that sinus tension headache. And so we also use points that are kind of local on the face to kind of free up, bring energy and bring energy flow in those sinuses.
Right. Okay. Now, I know that a lot of people, when they hear acupuncture, they just think needles. And that's something that I was scared of too before
Right.
I went in. Can you just describe what a typical appointment would be like and if there is pain involved or how that process goes?
Right. So, Chinese medicine, it's a holistic medicine. So, like, if you're coming in for pain, yes, we're going to address the pain, but we're also going to talk briefly about all systems in the body, ranging from, how often do you get headaches? How often does that happen to, all the way down to your digestive system, so that we know kind of overall what general health you are in. And so you'll come in, we'll do a history taking, sometimes a little bit of a physical exam is involved. As far as the needles, does it hurt? Okay, that's kind of a hard question. Everybody's different in how they react to the needles. I will tell you, the needles are super thin. They're super, as I call, like they're a little flimsy. You can literally flick the needle and it'll go back and forth like it's like a little feather kind of. And so I tell people you can fit one acupuncture needle inside of a regular syringe that you would get your blood drawn or you would get a vaccine. So, also, what I kind of tell people, there's a difference between feeling pain and there's a difference between feeling kind of uncomfortable. So, with acupuncture, especially if it's your first time, you're going to feel different sensations. It is a needle. You will feel that initial prick when it goes in. That goes away super quick. You might feel a temporary electrical sensation that might go up your arm or down your arm or in the other extremities. Some people may feel like a full sensation. Some people might feel like a heavy sensation. Honestly, 50% of the time, people don't feel anything at all. And then that's when I say, there's a difference between feeling pain and feeling uncomfortable. Those uncomfortable sensations are going to be like that heavy sensation, the electrical sensation. Pain is going to feel that sharp sensation. I always tell patients, keep communication open with me. If you do feel pain, that sharp sensation, then we adjust. If you're feeling those other sensations, then that's normal, and I just kind of coach them through it to get through it. And normally, after, if it's more intense for them on the first session, usually the second or third become a lot easier since they're used to those sensations.
I see. Now, 2020 has definitely not been an easy year for anyone mentally or physically, especially in terms
No,
of the pandemic.
right.
Whether it's with acupuncture or just in general, what other health tips do you have for listeners right now?
I think a lot of my health tips are things that I would suggest even if we weren't in a pandemic. Um, I strongly suggest people take some time, look at what their day to day health is like. What decisions are you making? Do you eat fast food? Do you eat processed food? Do you not eat enough vegetables? So my suggestion to people at this time is to take maybe 30 minutes, maybe an hour, and just reevaluate your health and see, okay, what are easy changes? I always stress easy changes. So I tell people right now, the best medicine for you to prevent getting sick is definitely a more plant-based diet. It doesn't mean you have to be a vegetarian. It's just making sure you're getting more home cooked foods, less processed food, and getting out and moving. Even if it's just taking a simple walk for 30 minutes, you don't have to go out and become a marathon runner. It's just getting your heart rate up and getting your regular exercise in. And then, of course, making sure you have activities that help bring down your stress. Stress does decrease your immune system. So if, you know, exercise is a great way to get those endorphins going and to just decrease your stress. And find an activity that makes you, happy and stress free. If that's reading a book, if it's knitting, if it's drawing, whatever it is. Just find something that makes you happy and calms you down at the end of the day. And then, of course, my other tip is come get regular acupuncture and come learn about what acupuncture can do for you and just your overall general health.
I love that. Well, thank you so much, Monty, for taking the time to talk to me today. I learned a lot on this call, and I'm sure listeners will appreciate it as well.
Perfect. Thank you so much for having me, Emily.
Thanks again to Monte Labash, an acupuncturist with Del Sol Community Wellness.